now for a closer look at the situation inside California's hospitals especially. Let's bring in Dr. Anish Mahajan, Chief Medical Officer and Interim CEO of Harbor-UCLA Medical Center. Dr. Mahajan, good morning to you. We got a pretty good look there at what's become a dire situation in California. As I understand it, your hospital currently out of ICU beds. What do you do now?
Well, across the region, we are at 0% ICU capacity. And what that means is we, across the region, including our public hospital, are putting ICU patients in sections of the hospital that they're not usually cared for. We've converted a large section of our emergency room into a ward for ICU patients who are seriously sick with COVID. We are on the cusp of converting our post-operative areas where we recover patients after surgery as another location to have patients seriously ill with COVID cared for.
Dr. Mahajan, if you don't mind me asking, have you been one of the frontline workers who's received the vaccine? How many of your employees so far have received it? Do we know?
Yes, the vaccine is an incredible glimmer of hope for healthcare workers and for all Americans. We started vaccinating last week. Over 600 of our staff who are frontline workers, custodians, ICU doctors, X-ray techs, nurses in the ICU and ER have been vaccinated. We'll vaccinate another 1,000 this week. This is wonderful news. I haven't seen a jovial atmosphere like I have seen in the hospital among our staff until last week when we started vaccinating people.
Yeah, this crisis standard of care that Erin just alluded to in her report, we know that the plans have been drafted for certain hospitals, including yours. Again, this is when a hospital gets so overwhelmed with patients and with limited resources, you have to make difficult decisions about which patients receive care. How do you go about making those decisions?
Well, the crisis standards of care, we are not in a crisis standard of care yet. We're right on the cusp. No physician or nurse in the United States of America ever expected to work under a crisis standard of care. But what it is that we run out of critical resources. It could be we don't have enough ICU beds or nurses, or we don't have enough ventilators or oxygen setups. At that time, based on ethical and moral principles that have been set out by ethicists, that we have guidance from the state, our health system has adopted those guidelines, and we have a plan to make hard decisions about how we allocate key resources like that to make sure that patients who can benefit the most get those resources.
Essentially, decisions potentially about who lives and who dies there in the hospitals. I got to ask you while I have you here, this has been going on now for, 10 months, roughly 9 months. The psychological toll, the emotional toll that it's taken on doctors and nurses, not just in California, but around the country. What are you seeing and what are you hearing from your doctors and nurses?
The healthcare workforce has, this is the 11th month of the pandemic. People are tired and exhausted. One of the bright spots is the vaccine. Another bright spot is that we know so much more about the virus, and there is sufficient PPE in our hospital and in most places. That said, people are exhausted. We have healthcare workforce getting COVID. We have healthcare workforce members who are getting sick from stress-related conditions. The mental toll is incalculable on the folks who are on the front line because they're often the ones holding the hands of patients who are dying alone because we can't have family members coming into the hospital because we have to protect them and everybody else. This is just such a devastating situation that if we can just get folks to reduce their risks, especially going into Christmas, we can try to slow this thing down so that we are not watching unnecessary death through the month of January.
Dr. Anish Mahajan. Dr. Mahajan, thanks for your service and thank you for your time this morning as well, sir. Happy holidays.
Thank you.